Magnesium is an osmotic laxative and it has a long history of use for treating constipation. In females with mild to moderate chronic constipation, 500 milligrams of magnesium oxide taken 3 times a day for 28 days significantly improved the frequency of spontaneous bowel movements, colon transit time, and the Bristol stool consistency score when compared to placebo. Symptoms overall and constipation-related quality of life were also significantly improved. In adults with chronic constipation, 28 days of treatment with 1500 milligrams of magnesium oxide or 1000 milligrams of senna per day significantly improved the symptoms overall compared to placebo. There was significant improvements in the spontaneous bowel movement, and complete spontaneous bowel movement was also seen in the active treatment arm compared to the placebo. Because mild abdominal discomfort can occur with higher doses of magnesium, it's best to gradually increase and or divide the doses during the day. In healthy individuals, the kidneys can filter 2000 to 2400 milligrams of magnesium daily. Perilla frutescens is a plant in the mint family and it's native to East Asia. Its leaves are rich in polyphenols, and in addition to being a flavorful and aromatic ingredient in many traditional foods, perilla leaf has been historically used for allergic, respiratory, and digestive ailments. In randomized controlled trials, 47 participants with gastrointestinal discomfort and reduced bowel movement frequency were treated with either perilla extract twice a day or placebo for 4 weeks. All the gastrointestinal symptoms, including abdominal discomfort, flatulence, rumbling, fullness, and bloating, improved significantly in the perilla group. For bloating, the positive response rate in the perilla group was 83%. Perilla may have several modes of actions that contribute to its beneficial effects for digestive symptoms. Preclinical studies indicate the perilla stimulates the motility of the intestinal tract, and it might relax intestinal muscle spasms. Other studies found the perilla extract inhibited the inflammatory response generally and specifically in the large intestine. Stress, anxiety, and depression are known to be associated with changes in pain sensitivity, gastrointestinal motility, and intestinal permeability via a complex network that connects the gastrointestinal tract, brain, immune system, and microbiota. In addition to preventing a stress-induced inflammatory response, an essential oil extract of perilla prevented depression-related behaviors in chronically stressed mice. Another study also noted a reduction in the sign of stress-induced depression and a reversal of stress-induced changes in brain metabolism in mice who were treated with perilla essential oil. Activated charcoal can be useful as a palliative agent, especially for post-infectious IBS. It's used to enhance the elimination of toxic substances via the GI tract. Due to its adsorbent nature, the activated charcoal also helps the body to eliminate immunogenic and toxic byproducts of infections, such as bacterial endotoxins. Activated charcoal has been suggested as a palliative agent in the treatment of diarrhea due to its low rate of side effects compared with anti-diarrheal treatments. A multi-center study of activated charcoal for the treatment of IBS, including approximately 60% who reported constipation as a symptom, found it was well tolerated and efficacious in nearly 80% of the individuals after 3 months of treatment. Even the patients who began the study with severe and moderate constipation had substantial improvements. Flatulence, stool consistency, and abdominal distension were also reported to be improved. The activated charcoal has been studied and shown to be supportive in reducing the severity and the frequency of chemotherapy-induced diarrhea. Activated charcoal use can cause constipation in some individuals, and the stools can appear black with the activated charcoal use and can be mistaken for blood in the stool. Importantly, taking activated charcoal at the same time as prescription medication can reduce the amount of the medication that your body absorbs. Therefore, medication and activated charcoal should not be taken at the same time of the day. Zinc Carnosine is a form of zinc backed by multiple studies, suggesting that it supports the health of the gut lining, improving the integrity of the tight junctions and protecting the intestinal villi from damage. Increased intestinal permeability has been shown to be an issue in individuals with IBS, and it's been associated with visceral hypersensitivity. Zinc Carnosine also has some anti-inflammatory and antioxidant effects, which can lend to its usefulness in IBS. In a crossover study in healthy volunteers, zinc carnosine at a dose of 37.5 mg twice a day was shown to ameliorate the increases in intestinal permeability induced by non-steroidal anti-inflammatory drug use. In a randomized control crossover trial, at the same dose, the zinc carnosine was shown to significantly reduce the increase in the intestinal permeability seen with heavy exercise. Effects were greatest at the end of the study, with a 71% decrease in the permeability after 14 days of treatment. Collagen is often purported to have a gut healing effect. Numerous gut healing diets and collagen-enhanced products on the market allude to this effect. However, human studies with collagen for this purpose are lacking. Nevertheless, preclinical research for cellular and animal studies suggests collagen peptides may support the gut integrity and reduce inflammation related to increased intestinal permeability. Specifically in mice who were subjected to burn wounds, a setting known to increase intestinal permeability, at 7 days post-injury, treatment with collagen peptides had a greater effect than glutamine on reducing the serum endotoxin level, which is a marker of the intestinal permeability, and the inflammatory markers TNF-alpha and interleukin-6. Other research with the same animal model found a reduction in burn-induced intestinal permeability and disruption of the tight junction when collagen peptides were supplemented early after injury. Findings from cellular studies with cacao 2-cell monolayers, a common model for studying intestinal permeability, also suggest the collagen peptides reduce intestinal permeability induced by the inflammatory trigger TNF-alpha. Curcuma longa is well known for its impact on inflammation, and it's been studied for numerous conditions in which inflammation plays a role, including IBS. A systemic review and meta-analysis of 5 randomized control trials found that curcumin did not have a significant impact on IBS. However, the studies were fairly heterogeneous, as they included both variable doses and combinations, including other nutrients. It was noted that 3 of the 5 studies independently found positive and significant effects on IBS symptoms. In one large non-placebo-controlled trial, included in the review, the consumption of 72 or 144 milligrams of curcuma longa extract daily for 8 weeks significantly reduced the IBS prevalence and improved the quality of life. Several natural compounds, including adaptogenic and nervine herbs like bacopa, holy basil, lemon balm, and ashwagandha, may benefit the IBS sufferers by mitigating stress. Research on Bacopa monnieri indicates it has adaptogenic effect and can significantly decrease the stress-related anxiety. In a 6-week randomized control trial, Bacopa in combination with other herbs was found to be particularly beneficial for IBS. For more on IBS, herbs, supplements, or natural treatment plans, check out my website.